My name's Amber Pedigo, and I chose to do my research project over congestive heart failure. I am a medical assistant with Graves Gilbert Clinic here in Bowling Green, Kentucky, and I work in the cardiology department, so I help see and treat patients with this condition on an everyday basis. So, congestive heart failure is where the muscles of your heart have weakened over time and they cannot pump the blood and the oxygen throughout your body as well as they usually would. There are different types of heart failure. There is left sided heart failure versus right sided heart failure, which just means one side or the other of the heart, those muscles have weakened. There is what's called combined heart failure, and that's where all of the muscles of the heart have weakened and are unable to pump the blood and oxygen well. And then there's two different types of left sided heart failure, and that's diastolic or systolic heart failure. So, some causes of heart failure. So it's more on the lines of who are who are more at risk of developing heart failure. People who have high blood pressure are at risk. People who have high cholesterol or coronary artery disease are more at risk. People who have uncontrolled diabetes are more at risk. People who are overweight and inactive and don't follow a heart healthy diet are also at risk. And there's also some kind of heart conditions that can lead up to getting congestive heart failure. So, cardiomyopathy, myocarditis, if you have like a congenital heart disease, people who have heart arrhythmias like AFib or SVTs, which is supraventricular tachycardia. It's from where your heart is working overload and where it beats really, really fast for an extended period of time. Those type of things can attribute to you getting congestive heart failure later on in life. So, some kind of classic signs and symptoms of heart failure. Not everybody will present with these. Most of the patients that I see that have heart failure, they usually have swelling in their feet, legs, ankles, sometimes their hands and their abdomen from excessive fluid retention. They are short of breath, unable to really breathe with exertion, having trouble breathing when they lay flat, and that can be contributed to fluid being built up around their heart and in their lungs. Some of our patients can present with chest pain, fatigue, palpitations, where your heart like flutters, skips beats, races. Um, and then with heart failure, so it can affect other organ systems. So, like your lungs or your kidneys. So, if your lungs are working overtime to help you breathe because there's fluid around them, or your kidneys are working overtime because there's fluid being built up and it's trying to get rid of it. All of those things can be like a domino effect from people who have like congestive heart failure. So there are some diagnostic tests that can be used to help determine if you have heart failure or not. So most times when you enter a cardiology office, you will get an EKG, and that is a rhythm strip of your heart. So it's going to tell me what rhythm your heart's beating in. So if you have an arrhythmia, it can attribute to you having congestive heart failure down the line. We would look for EKG changes. We would also order what's called an echocardiogram, and that's just simply an ultrasound of your heart. We look at your heart valves, we see how the blood flows in and out of your valves, and we're also looking at what's called an ejection fraction, and that is kind of like the percentage of like your heart function. So, a healthy ejection fraction is anywhere between 50 to 70%. So, 50 to 70% of how your heart's functioning. People who have less than 50% are those who are more at risk for developing congestive heart failure. There is also a blood test that we would order to kind of help determine heart failure. It's called a BNP, like N as in Nancy, and that test can determine if you have fluid built up around your heart. And we would also order a chest X-ray as well to see the fluid buildup between your heart and your lungs. So there's also other tests that can be ordered to attribute to kind of helping determine if you have heart failure, we could order what's called a stress test. And there's two different types of stress test. There is a walking treadmill one, where a person walks on a treadmill and they're hooked up to the EKG machine, and we watch their rhythm strips as they're walking. Or we do what's called a nuclear version, and that's where they inject a medication into an IV, and it gets your heart rate up and going as if you're doing exercise. But you can either be laying flat for those who have trouble walking on a treadmill, or there is a nuclear version where you are walking on a treadmill, and they take pictures like before and they take pictures after the stressing part of your heart. And depending on that test, some people may need what's called a heart cath or heart catheterization, and that's where they feed a wire through like your veins and arteries. They can do it through your wrist, or they do it in the leg, and they feed it up to the heart, and they check for blockages. And if they have blockages, they can put stents in at that time. So the treatment for heart failure, we tell our patients it is highly important to take your medicines that are prescribed for heart failure. And we treat heart failure patients with a combination of medications. So there's not just one medication. Most of our patients are on 2, 3, 4 different types of heart failure medications to help manage it. So some of those medications, we use beta blockers. So like your metoprolol, carvedilol, bisoprolol. Those are kind of like an overall heart protected medicine, and they have several purposes. So they can slow your heart rate down if you are tachycardic. They can help with your blood pressure, and they're just like an overall heart protected medication. We use ACE inhibitors and ARBs, so like lisinopril, bonanzapril, losartan, valsartan. All of those are blood pressure medications to help manage blood pressure. We would use diuretics like Lasix, Bumex, metolazone. Those are to help get fluid off of your body. So people who gain weight rapidly from fluid accumulation, we would prescribe them Lasix to try and get the fluid off of them. We would also, at that point, we would check their electrolyte panel, so like a BMP or a CMP, to make sure we're not depleting any of their electrolytes. So there's a new type of class of medications that are being used for heart failure, and they are SGLT2 inhibitors. Those medications are like Jardiance and Farxiga. They are most commonly used for people who have diabetes, but they're being shown now to show effects to help improving people with congestive heart failure. And we also use medications like spironolactone, chlorthalidone, and hydrochlorothiazide. Those are medications that can help lower your blood pressure, but they also have a water component to it that helps draw salt out of your body and helps get fluid off of you. Also, treatment for congestive heart failure is just living an active, healthy lifestyle. People who eat right, eat a heart-healthy diet, get 30 to 60 minutes of exercise every day are ways to help treat your heart failure. So, what is the prognosis for people who have heart failure? So, this is a chronic condition, and people who have this condition, it can be managed. So, with it being chronic, there is no cure for it. But it can be managed to where you can live long, healthy, meaningful lives. And the thing that we say the most is take your medicines as prescribed. Because once you don't take your medicines, it can jumpstart your heart failure right back up. And it's harder to manage it after that. Living a healthier lifestyle, eating a heart-healthy diet, all of those, they will make you feel better, and they will help manage your congestive heart failure. Hope you enjoyed this presentation. If you have any questions, you're always more than welcome to ask me. Thank you and have a good day.